Excellent. Welcome everybody to this webinar brought to you in association with HASANS and New Zealand Occupational Nurse Association. So today we're going to hear about what Fonterra has done around COVID-19, and great to hear from Terry Buckingham and Peter Lynn. So there'll be about a 25-minute presentation, and there might be an opportunity to ask questions during that time. And then there'll be Q&A. So if you look at the bottom of your screen, you should have a Q&A box. So throughout the session, can you please put your questions in there, and we'll give it to answer all of them. So at the bottom of the screen is a Q&A box. So hopefully everyone sees that. So you will be on mute and video's off, and yeah, we'll go from here. So over to you, Claire and Terry.
Okay, so I'm Claire Lynn. I'm practice leader of the health and wellbeing team at Fonterra, and I'm also NZ OHNA acting co-president along with Heidi Borner. Terry, do you want to introduce yourself?
Yeah. Hi guys, Terry Buckingham, head of health and wellbeing at Fonterra, and I don't have any other second title at the moment. Claire?
I can think of a few.
Yeah. Let's not go there.
All right.
So we're going to take it in turns with some slides. I'm just going to do the big picture. Terry's going to talk about Fonterra big picture, and then we'll go down to some of our processes. So first of all, from the organisational perspective, for Fonterra, we are a food manufacturing essential service. And again, we had that sudden impact on our community and our business. And I think you're aware of lots of those points there. So for us, with the sudden change, what came in really important was the difference between managing the situation to leading the situation. So with managing, it addresses the urgent needs of the present, the immediate choices and allocated resources, where the pace is fast and actions are decisive. Leading, by contrast, is about guiding people to the best possible eventual outcome over time. So there needs to be a focus on what is likely to come next and readying to meet it. So it's about seeing beyond the immediate to anticipate the next 3, 4 or 5 obstacles. So it's avoiding taking a narrow vision, being seduced by managing only, and over-centralizing the response on certain aspects only. So we need to be agile, adaptive, and seek order rather than control. And most important is never forgetting the human factors. You'll see in the little light orange box below, there's links to some key documents that will help you through each of the points on the slide. And of course, in our people space, all of this is about keeping our people, their families and communities safe. It's our main priority. And we also need to understand the change in work risk profile, be it someone's working in home or they're an essential worker. So our new norm with our normal support systems definitely have become disruptive, and that work impact has been significant, be it that someone's become busier or suddenly there's no work. And we need to acknowledge it's a difficult time for the whole country, not just Fonterra, and in particular for our health and safety professional group. We've been affected as well. And a reminder that physical distancing doesn't mean that we can't be sharing or social. At Fonterra, we've got 8,000 staff as essential worker roles from our farms, our tankers, factories and retail. And we have 4,000 workers working at home now.
Yeah, team, this is where I come in and just sort of mention how we kind of structured our crisis at Fonterra. When we first started, we had the people stream there on the box on the right there. We really just started really with that small group of leaders to say, okay, let's have a look at, dust our plans off. We realised that we were kind of the plans were pretty much based on our SARS, the last SARS issue that we went through. But fortunately, we have a really good structure in the background of incident management team and the crisis management team, and we're able to bring together that strategic response team, which is essentially made up of our Fonterra management team, and then right through down to the BCP teams, which are at each site. So each site runs their own BCP team. We've got 30 plus sites across New Zealand. One thing I haven't talked about is a little bit about Fonterra, but most of you probably know what we do. Yeah.
Can I interrupt you a second? Claire, is your screen, is your PowerPoint on a full screen? On the full screen tab, do you know what I mean?
Yes, it is.
Okay, that's right. Cool.
Is everyone seeing it okay? Yep. Are there messages there for you just to check everyone's seeing it okay? Yeah, cool.
You can, just for people on the call, I think someone texted me saying when it's slightly larger, but you can drag around the size of it's fine, thanks. So it's good to carry on. So you can drag around the size of make it bigger on your own screen. Anyway, sorry to interrupt you.
Yeah, no, that's okay. I think everyone, I was just talking briefly, wasn't I, about Fonterra, what it is that we do. I think most people understand that it's you know, a New Zealand-based company working around the globe in different markets, and we've got about 12,500 farmer shareholders that own the company as a co-op. And so basically the way I like to talk about it is for every farmer, there's one person, New Zealand worker, working in New Zealand to process and make and send the product overseas. And then there's one more for every New Zealand worker working overseas to make up our total of 22,000 employees worldwide. So essentially, you know, I don't want to make out that we're perfect when we came into COVID-19. As you know, that we've only really known about this novel virus since the 7th of January. So we spent a bit of time during January and February supporting our China business. But these are our alert codes and how they reflect the Fonterra codes on the right-hand side. Go to the next one there, Claire. The pandemic plan was really what we needed to prioritise in the early stages. And what I'd say about the plan is that the planning was definitely more important than the plan, right? And I would say that that's probably the same for other organisations that you're working in as well. Finding out having a plan is great, but actually the planning and the amount of people that you bring to the plan and those discussions are more important, I believe. Next one. And our earlier response, this is really what we started doing in January, was really supporting our China team. Some of you know that we've got about 2,000 employees over there, and we actually had 12 people in Wuhan City itself, so making sure that they are able to work from home, get into self-isolation. We did a lot of learning from them as well. We also did a lot of restricting of travel, international travel. That was initially a large chunk of our work, was making sure that people were able to return safely home. We do have some international assignees, otherwise known as expats, that are overseas as well, bringing them home safely, and sometimes that included their families, but really just preparing our teams for the next stages. Communication was really key, sort of having one source of truth, so making sure that Miles was able to lead, and we set him up for success as well, making sure all the communications were on track with how COVID-19 was going, and then government announcements that they were coming thick and fast, quite hard to keep up with. But I guess just using that kind of three-tiered approach, so that we're able to give people FAQs, information socially as in the social media as well, that's consistent and clear. The other thing that we did was make sure we use our own kind of tools that we already had, like the wellbeing portal page at Fonterra, so internal intranet style web pages. And then having a triaging, one of the things we initially got swamped with was the amount of email that was coming to our team. As a lot of it was around infection control, how do we do this, how do we do that, but taking a very standardized approach and having one email address so we could triage all of the communication that was coming to us, so that we're able to then share it out with the team. But then also bringing other members of the team in as well, other people that wouldn't traditionally fit within our team, but drawing them into the conversation as well, getting on the COVID bus, as they say.
So for one of the first things we did as well was develop the more deep dive information and resource development. And a key learning for us was that we should not assume that everyone understands COVID-19 and the importance of each prevention control. So this effective awareness program did make a significant difference. Sort of worker understanding on environmental sanitation to the physical distancing and why it's so important was an important focus for us. And we decided to use our own Fonterra imaging and language, including editable posters, not edible, but editable posters, for which included other countries and languages. And the benefit of having targeted tailoring information for our audience made it more real for them and really promoted that ownership and local buy-in. So we definitely had a campaign approach. And you'll be aware that the government has created some COVID-19 posters for business as well. For our nursing team, we have 22 members in our team, and we're based from Fonterra to Invercargill, and we work across all New Zealand Fonterra sites, and some of our nurses can have up to 4 sites each. Our normal business is 700 pre-employments per year and 12,000 periodic health assessments, and it's usually face-to-face consultations. So that was turned upside down. And as essential business, we really needed to continue to operate from food safety quality regulations compliance for open food product handlers to a continued recruitment of business essential roles. So we're changing our ways of working as a nursing team. There was a good communication and approval process to the leadership teams, and our memos captured key changes, and we're going to continue with this interim controls for the next 3 months and then review. So we have some awesome team members, in particular Amanda Locke, David Browning, who developed these online health questionnaires that met the interim food safety quality requirements. And there's no face-to-face consults with our nursing team and staff at the moment at this current level, alert level. Wherever with the questionnaires there's any health variants, the nurse will follow up via Skype or a phone. And definitely for pre-employment medicals, post-COVID-19 restrictions, we'll be following up with baseline tests. For new ways of working for our people, I think there's been a lot of literature out there. So definitely working processes were developed to support people working from home. That included taking their workplace office equipment home, IT technology, making sure it wasn't overloaded, so creating some rules and advice on how to use IT, and the importance of staying connected and functional as a team. In particular, we were keen on people understood their own personal responsibilities in protecting themselves and others, such as personal hygiene, physical distancing, and we needed to put in some new processes on care and support for at-risk or vulnerable people. In particular, in the early days, we noted there was a lot of anxiety. Our default was let's be extra safe and you work from home. So processes to reassure people, give them good information, and that individuals of support when there was anxiety. So that mental well-being was important. For our at-risk vulnerable people, again, there is good government advice through Ministry of Health. And so for the age 70-year-old or older, chronic health conditions or immunocompromised, in particular, we set up some systems for doing good risk assessment and support management plans. And also applied a risk matrix where you know, the difference between someone is asthmatic, but are they stable or unstable? What's the current alert level or the nature of work? So what's the exposure risk to that person that might affect their health? So it's responding to the current COVID-19 conditions. With medical certification, we introduce new processes to obtain a tailored, accurate health professional advice or instruction. And current situation is GPs seem to be readily available to provide health certificates, but we have put in alternative processes that our occupational health nurses can give health advice, or physios that are involved in active ACC claims can provide those interim health advice instructions. And again, resources were developed, such as a GP letter, where we provided the GP with information of what the workplace exposure risks and tasks might be. We've included Dr. David Beaumont as an expert occupational health specialist for advice for any complex health situations, and our ER team are actively involved in leave management.
So this slide here is shared by the Health Nurses Association, but really trying to, I guess, define, you know, what all those different categories were. And I think probably everybody on the call knows what a confirmed case is now, but, you know, all this language is flying around, wasn't it, around suspected cases, close contacts, casual contacts, and, you know, it's really hard to try and decipher. But this is a really good way of actually just trying to work out who should isolate, who should self-isolate. At Fonterra, we actually had 4,000 staff members that were actually able to work from home. So fortunately, our self-isolation criteria initially didn't need to be so tight, because we were able to let a lot of people work from home. But we still have 8,000 workers that are essential workers that need to come to work each day across our factories and manufacturing. And so helping to understand who should isolate and who shouldn't isolate was a real key one for us. Next one, clear. Now this is just a little simple graphic actually that we stole from the Safe Work Australia infographic. I think things like this really enable, I guess, enabled us to help send simple messages to our people, you know, to stay at home if they're unwell with symptoms, you know, what to do, how to navigate, I guess, the process in a very unfamiliar situation, right? What needs to be cleaned, what needs, you know, how do we even manage people going from home to work each day, and the essential letters and things like that that you needed to carry just to be able to go to work each day. So just helping people navigate through change through simple messaging. Next one, Claire. The self-isolation register was something that we really had to get our heads around really quickly. So initially what we did is we had an email address, and people would email managers would email their people onto the register, and we put them on a simple Excel spreadsheet. Once we got into a mode of actually getting people on the register, starting to report out on it became a bit of a problem. So we got brought in the data analytics team at Fonterra. We're lucky enough to have access to a lot of IT specialists who are able to bring their brains to it and their talents to it, and created an online register now. So you can see out there, that's Claire's inbox on her right hand side there, so she can manage her people, their Judy and Carol. So she can actually go in there and update their details on the self-isolation register. She can take people in and out of that register at any point, and then report any instances, for example, if they've been tested or confirmed cases and things like that. So it's been a really good tool for us, and it's helped our leadership team to understand where we're at as a business, and they can look at how many people we've got in isolation at any one time and what categories they fit in, for example, vulnerable categories. This was something that we developed quite quickly as well, a contact tracing process. We knew we would need it if we did have confirmed or suspected cases in Fonterra. And you may have already seen in the media that actually we have had confirmed cases at Fonterra, and we'll show you a slide shortly, but this one. But essentially, when we had a case, we had to be careful that we tracked all those close contacts to be able to understand who may or may not have been affected. And we're lucky in this situation, we were able to develop a process to get those close contacts identified really early, and then able to reopen part of our factory in Edendale quite quickly. Just a word of warning, don't believe everything that you read in the media, but it is a really good example of where we were able to respond really quickly, and actually a little bit quicker than public health. And we were able to get public health team through the medical officer of health on board through several meetings and just work through that really quickly. But that was one really good save. And I think we will start to see that, won't we? We will start to see more and more cases across the workplaces and the worker community. I think the medical officer of health had a good quote. He said that essential workplaces will be the new battleground, essentially, for contact tracing.
So this is our final slide, because we were aware that we only had a short time to present and then sort of open forum. So there was many other focus work going on to reducing the risk of COVID-19 in the workplace. So, for example, how we deliver first aid, particularly the site visitor and contractor management, using COVID-19 precautions, PPE, when people should wear protective equipment, in particular whether they're working within the 2 meters or outside of the 2 meters became an important consideration. Sanitation, environmental hygiene and post-sanitation processes were important. Distancing controls, being them engineering controls or just human behavior. We have introduced temperature monitoring at all of our sites. We were very aware there's a little bit of controversy about their effectiveness, and it is very much a last defense, but it's a very clear reminder to people about stepping into the workplace and making sure they are symptom-free. Of note, we have found that people have arrived with high temperature, and quite often for infection reasons, such as cellulitis or recent stomach bug, or they are also displaying other COVID-19 symptoms. So also what's exciting is there has been a lot of innovation coming out as we manage the crisis, from using our 3D printers to make face shields, making our own hand sanitizer product that we've shared with other business. And currently we're just exploring point of care COVID-19 testing, but again, there seems to be a little conflicting health advice out there on their effectiveness, but we'll keep exploring that option. So we're hoping that this presentation has given you a little bit of an overview, and I think a lot of things that we've done at Fonterra, yes, we're a large organisation and have got good support people in place to help us do these things, but any of these focus points any business should be considering, and I think our occupational health and safety professional groups are really well positioned to assist businesses with these processes and making sure that they are robust in keeping their employers safe. So that's us, and now open for questions.
So thank you. Can you, I'll put you guys so people can see you. Oh, you can do it yourself actually, and take off.
Stop sharing.
Stop sharing, yep, thank you. My word's right. Thank you for that. So now we've got some questions coming in, so keep firing those questions in. We've got a few questions here. Could the self-isolation register template be shared?
I could probably answer that one. Yes and no. I think what I would say, guys, is that really all you need to do is capture the different categories that you're isolating people under, whether it be vulnerable or because they're a close contact or a confirmed case. And then really just, using those as categories for creating your own templates. The tool that we've developed in-house was really with the IT analytics team. And I don't, to be honest, completely understand how it kind of works in the background. But certainly what I would say is that, hey, you probably don't even need a template, but just create one for yourselves or for others as well would be fine. I don't think you would actually need our one. I think it would end up being too complex for its own good. Does that make sense?
Excellent.
I think the categories are caught on the slide.
Okay. How do you manage any blame, shaming, bullying
so important
around testing?
Yeah, so important, isn't it, around that dignity and allowing people, to self-isolate with, suspected cases and confirmed cases, and managing the PR that's associated with that. Very important to protect people's privacy as we go. And that obviously is just restricting it to a small team and actually having one point of contact for those people too, if you do get a confirmed case, to help them navigate the communication back with the business, and just really putting the power back into the manager's hands, right, to help manage their people. They know them best, right?
Question around public health. How do you work in with the public health, presumably the Ministry of Health?
Initially, because the medical officers of health, there are only a few of them around the country, right? So, we don't want to take up too much of their time, but we did, when we had the Edendale example, what we did there is we worked and brokered that through Dr. David Beaumont to talk doctor to doctor first, to be able to kind of broker that discussion, and linked up with Dr. Michael Butchard. He's the new medical officer of health down there, and that was really good. We were just able to kind of work with him directly then over a few calls, and that's how we did it.
Cool.
Yeah, the link should work on the PowerPoint.
Link should work. All right, good. What model and make of thermometer are you using?
The ones that we originally put in place are not currently available. So we have been using different types, but availability is difficult. But yeah, we could provide that information.
The key thing we found was the temporal artery thermometer. So if you're looking for the infrared temporal artery thermometers, seem to work the best. The ones are the touchless ones. Yeah. But what we did find is that, you do get what you pay for. So if you're, the price range anywhere from about $100 to $300.
So there is a temperature standard. So it's making sure it met the standard and non-touch with key things we were looking for.
There's a question here from Bridget. Great presentation, thank you. How are you sending out your Fonterra medical questionnaires so there's no face-to-face contact? And are you continuing to monitor?
So we're using Microsoft Forms, and it's just sending a link and completing the questions. It's incredibly quick and easy.
Yeah, just Google Microsoft Forms. It's a Microsoft platform. Yeah.
Right. Do you have a contact tracing checklist you're able to share?
Yeah, the contact tracing, what I would say about that is more kind of detective work, really. It's like doing any normal kind of investigations, just being very investigative and inquiring about the way you go about that, and to the point earlier around when you're talking to somebody who's a confirmed case and trying to work out where they've been and where they've been working and who they might have had contact with. It's more, I would say, less about the process itself, but more about just doing a robust investigation with that person's dignity in mind. I think.
And by trained, yeah. Sorry, Terry. And everyone was trained, weren't they, who did the contact tracing in that simple formula, and privacy was everything. On that slide, I have linked you to the Ministry of Health information on contact tracing. And again, that's becoming more important in their communications about suggesting that people keep a little note of where they've been, little diaries of their outside activities. So it's, yeah.
How are you managing contractors? site maintenance, all those sort of things? Are they part of the plan too?
So again, it's part of there's an approval process of, number one, should they be on site at all? And if they do, we do have a health declaration form that they have no current symptoms, all those risk factors. They're acknowledging that they're okay to come on to work. And some sites are creating additional induction processes that include COVID-19.
Great. Craig McDonald's made a comment, feedback for attendees, Google or Microsoft Forms are good, simple tools to develop registers and checklists that can be shared with staff.
Yeah, they really are.
Thanks, Craig.
Yeah.
One here from Heidi. Heidi, as occupational health nurses, did you connect them with Ministry of Health? And if so, how?
Yeah, connection, I mean, we realised that, Ministry of Health really busy at the moment. So really just picking up their tools and using their tools has been the key one. Is that what you're alluding to, Heidi? Or did we have a connection, a direct connection? We're just really using our networks really rather than connecting directly with Ministry of Health. I think they've had a lot on their plate as well.
I think we did in the early days, didn't we, Terry, particularly with pandemic plan and any advice that they could give us with their pandemic planning?
Yeah, we use their template, for example, the freely available one, which we've put into the slide, for our pandemic plan. Yeah, definitely.
Any advice on immunity testing and associated processes?
Yeah, I could answer that one. It seems like there's a bit of controversy out there about the IgG and IgM, type antibody type testing and the finger prick testing, and whether that's actually validated or whether it's actually going to be useful, or whether you can even tell if somebody's got acute infection. We've interested in doing some trials around that. We haven't committed to doing any of that testing. We're relying on the public health system for swab testing at the moment. But yeah, it's definitely something we've been exploring, but not committed to doing any testing ourselves, if that makes sense.
Yep. There's a couple of questions here around vulnerable workers. Are they reassessed each level? And have you reviewed with New Lens any of those done early on the piece when the criteria was new? So basically things have moved on. Have they been reassessed or are they reevaluated?
Yeah, I might be able to answer that one, Claire.
Yeah, go for it, Terry.
Okay.
No, absolutely. That is our current focus, isn't it, Terry?
And we're just looking at how we can return those vulnerable workers now when we go through those next alert level stages, at what time's appropriate, and what risk assessment's appropriate for those workers. Some of them we've realised will have to be a case-by-case basis, but we're also working on a bit of a decision-making matrix, working alongside our ER and our HR team to actually decide on how we actually return people, to make sure that fear and anxiety, but also those immunocompromised vulnerable workers are actually able to return to work without any issues.
And managing any anxiety around that return to work will be important.
Yep. You mentioned working with IT, Fonterra IT team before, Terry. What about other teams like business continuity? Have you worked in with them?
Yeah, so each site runs their own business continuity plan. So at each site. So those plans definitely have been really useful, but at a kind of central level, we're able to work with IT teams, employment relations teams, and at that tactical response and senior response team level to bring about some efficiencies for all of the sites rather than sites having to make up their own plans at a BCP level, if that makes sense.
And often the occupational health nurse has been closely connected or directly involved with the BCP at site level and been able to give good guidance and support.
A couple of questions there. I think you can probably see them, Claire and Terry, around sensor temperature taking, temporal thermometers. Any comments on the sort of type of temperature taking?
Yeah, infrared. They work through infrared, the temporal artery thermometers.
Yep.
And again, you want to make sure that you get a good one, that you've got good quality ones, so that you're And technique we found is really important as well. It's a little bit like using a tympanic. At the end of the day, if you don't get it in the ear properly, it won't work. And same with temporal artery thermometer. If you don't use it properly, and making sure that our people are able to use it properly has been the key. And the other thing that we're very aware of as well, if we get a high or low reading, making sure that we do it again to just check to make sure it's actually working okay. I think what we would say about the temperature monitoring is that we know it's not a silver bullet. You know, we know it's not the only thing that's going to help us prevent getting COVID-19 on our sites, but it is a bit of a stop and a check moment where when people are coming in the door, we're checking their temperatures each day. And actually it's quite a good stop and check moment. So have I got any symptoms? Do I have any issues? Do I need to talk to my manager about anything? And just to really kind of reinforce some of those steps, those infection control steps. And it really is just one layer, right? In the bow tie, or one layer of protection.
It's that last defense in natural human behavior. I don't want to let the team down. I'll be all right, mate. I'll come to work, and sort of, no, best place is stay at home at this stage.
Great. Are you encouraging contact diaries for your staff, for your employees?
Yeah, we haven't gone that far, but mainly because we've got pretty controlled essential worker environments where the essential workers are. As we go from essential workers to bringing back some of our staff through the different levels, it's certainly something we're thinking about. We haven't actually gone that far yet because we do know where people's whereabouts are at the moment. But I think if you were looking at other businesses, I noticed the other day when I went down to a food market, they were actually collecting people's phone numbers and time diaries, so that if you were in that food market at the same time as somebody else had been in there and they were able to track you, they were able to give you a call, right, and contact trace you quite simply. So I think there's going to be a lot of simple messages that people can do to improve contact tracing. And I think I'd encourage anybody else to do that as well. I think we've got to be careful around privacy. We've got to be careful how we collect and store and use that information. But I think most people are getting used to the fact that actually collecting people's phone number and a name is actually okay. We don't need their full address, if that makes sense.
Have you found anybody who is deemed to be recovered who is still showing symptoms, or who's still showing symptoms? Or
yeah, that happens, doesn't it? Where people are unsure as to when to return people to work. The Ministry of Health criteria, I think, correct me if I'm wrong here, team, but it's 10 days plus 48 hours following any symptoms. So we've taken a 14-day approach and 48 hours after the last symptoms to be sure that we're actually not, bringing any potential infection into any of our sites. Just that criteria is nice and simple for people to understand, and it also sort of fits with the criteria of 14 days isolation as well. But I think anybody would agree that you don't want to return anybody with symptoms anyway.
Yep. There's a couple of questions here around lower levels of alert, like going from 3 to 2, those sort of things, which you might be getting ahead of ourselves a bit. But how do you think the processes may change, or how do you feel about it? Yeah, do you think much about that?
Peter, do you want to answer that one, or I feel like I've been talking too much?
Oh, thanks, Terry. No, but it is keep planning, and it's taking a cautious approach. Definitely over the months, all the support processes from sanitation to personal hygiene, people have better awareness and understanding. But again, one thing we keep saying is that the rigor and robustness of these processes are essential. As the levels reduce and there is more community interaction, the risk of a potential community outbreak is there, and then coming onto the workplace. So it's keeping those strong processes in place for the foreseeable future.
Right. What about flu vaccinations? When do you think they'll be delivered, if at all?
again, this is a changing climate, and we are very much directed by Ministry of Health and access to vaccines. So we're ready, and we have a lot of occupational health nurses out there ready to vaccinate the working population, and it's just availability from Ministry of Health. So definitely 27th of April is a current date where there's going to be a review.
Okay. Coming back to assess and return to work, are you contacting family members who are maybe at high risk, or does your assessment stop with a member of staff?
No, it definitely includes if you're living with a dependent or someone at risk and vulnerable, we will apply similar process and support.
Yeah, and I think the key there is working with public health. Usually they're involved at that stage too. If we've identified anybody that might be a case on a site or anything, we're just working with public health to help work through them as well. So, you know, if there's anyone else that's outside of our influence, in other words, people that we realised that might have been outside of our sites. Fortunately, we hadn't had any of that, but if there is anyone, then, you know, working with public health team to actually contact those individuals as well.
Question from Heidi: have you provided any feedback to Ministry of Health on what you've found in your population?
Yeah, just through the medical officers of health, through those people. Yep, definitely. Some learnings as well from you know, what we've been involved in. As mentioned before, we've only had the Edendale case, so we haven't had a lot of that required anyway. Yeah.
Okay. If you've got any final questions, please fire them in. We've got another few minutes if you've got other questions.
I'd just like to also take a moment to acknowledge, was Terry and I are talking today, but there's been a lot of hard work from our health and wellbeing team and the wider Fonterra health and safety community.
Yeah, well said, Claire. We kind of feel like quite privileged to be able to operate essential service during this time, and you know, we don't take that responsibility lightly. So we've made sure that we've been shovel ready as well, haven't we, as a team, and putting our backs into it as well. And I have to say that our team have really stepped up and completely transformed the way they work, and not being able to do face-to-face. I guess for a lot of nurses on the call can be a really difficult time, eh? But I think what we've been able to do is at least provide a level of service and telephone conferences, that type of thing, to make things work. And been a huge learning curve for us, hasn't it, really? And hopefully we can pass on some of those learnings today.
Yeah, and a lot of hard work taking the government advice and other global advice and translating it into business language and keeping it simple, bite-sized and simple. But it's made it very effective.
Great, I think that's all the questions. Any concluding comments, Terry, Claire?
No, thank you. Thank you for the opportunity, Phil.
Thanks for joining us. Yeah, thanks for joining us, team. We've nearly got 100, what do you get, 96 participants at the moment. So thanks, team, for hanging in there as well. And yeah, really appreciate it. And any questions, obviously. Yeah.
How many are your relatives, Terry?
That's right.
Got a few dial-up friends in there.
Dial-up friends, a few bots. So just thank you for coming on today. We'll get out the presentation and the recording out to you shortly. So thanks for coming along, and hope it was useful. So yeah, thank you, Terry and Claire, for your time. And sounds like you're doing a great job at Fonterra. So keep it up.
Thanks for hosting, Phil. We really appreciate Hassan's approach.
Thanks. Thank you.
Bye.
Bye now.